Hi, thank you for tuning into HIV.gov, and we're live from PACHA. I'm joined by my colleague, Dr. Patrick Sullivan, and he's a PACHA member. He talked a little bit earlier about PrEP, and I would love to have him join and share some with you. Hi, Patrick. Thank you. I'm glad to have you here. Would you like to share a little bit about your presentation at PACHA today?
Yeah, thank you so much. We were talking at PACHA today about ending the epidemic and about where we are in that. And so one of the things we talked about was we keep saying, and I think it's true, that we really have all the tools that we need to end the HIV epidemic. We've got great tools, lots of ways to get tested and to learn HIV status. There's great prevention tools. There's great treatment tools. And so in my talk, I was really trying to think about what's going to determine whether we take those tools and whether we use them to really end the epidemic. And so there are a few things that we talked about. One was the idea that we need to have sufficient coverage. If we think about PrEP, if we think about treatment, we have to get enough people who would benefit, for example, from PrEP onto PrEP. It also needs to be deployed in the areas where the risk of acquiring HIV is highest. Like, we know the South is kind of a hotspot for new HIV diagnoses. So we want to be sure that there's enough of that PrEP in the South. But it also needs to be delivered equitably. And we sort of talked about the idea that in communities, whether it's a big city in the South or whether it's Black and brown people in the US who are at higher risk of acquiring HIV, those groups need to actually be served by PrEP at a higher level, at a level that's in line with what their risk is. And then we just need to sustain that over time. So those are some of the things that really, I think, will decide whether we go on to end the epidemic and how soon we do that.
Well, I want to piggyback off of what you just said. You said there are certain groups, like a Black and brown communities, that probably need a higher level of services. So when you looked at the data, and you shared this earlier with us, what does the data tell you when you take a deeper look at it in terms of PrEP and PrEP equity?
Yeah. So when we look at an equity metric, which just says if the risk of if the risk in the South is 3 times greater than the risk of acquiring HIV in other areas, or if the risk in Black Americans is 5 times higher, then the level of PrEP use should be corresponding to that. And so what we found when we looked at this was that, particularly for Black and Hispanic Americans, those groups are underserved by PrEP, inequitably served by PrEP. And so for Black Americans, the sort of equity percent was about 13%. There was like quite a ways to go to get to parity in terms of where the risk lies. For Hispanic people, more like 23% or something of the way to that equitable level. And women were underserved by about 60% by that equity metric. And so I think we just need to think about what steps can we take to make PrEP accessible, to provide the information to let people consider this as a prevention option for them.
No, thank you so much for sharing your insights. And for more information, please come back on HIV.gov.